we are with another conversation about vestibular, and I have our Director of Clinical Excellence, Ashley Langford. I have Caitlin Whiteley, clinic manager, senior clinic manager and physical therapist. Also has some experience with teaching vestibular, and same thing with Mark Martire, our clinic manager and physical therapist. Also has experience teaching vestibular. And I'm Adam Goodrich, the marketing guy at Cora. And we are going to start by, they are going to start by helping me understand when I say vestibular, do I say, I have a vestibular injury, a vestibular disorder? And then in the next, say, 5 to 10 minutes, we're going to talk a little bit about what the patient audience or patient population should know about vestibular, and then also a little bit about what the clinical audience and population should know about vestibular disorders, injuries, etc., what have you. But let's definitely dive in. Whoever wants to jump in first and help me understand how I describe vestibular, have at it, and then I'm going to have some more questions from the layman end of things.
And what it encompasses, right? I mean,
for me, I definitely don't use the term disorder. I typically will use vestibular dysfunction. I try to relate it whenever I'm explaining it to a patient or students. I try to relate it to any other injury in the body. It's just another system that we have that can get impaired, and then we go through our tests and measures, and we figure out what these impairments are, and we develop a treatment plan. For me specifically, again, I think that hitting that as a point of topic is super important for patients and for clinicians trying to treat this. I think there's, for whatever reason, a hesitancy from clinicians specifically to learn more about it, and they think that it's this huge system that's super confusing and complicated. It's just not the case. I think that it's just like anything else. If you just practice it, you take some courses on it, you learn a little bit more about it. It's just an untapped patient population that is in huge need for us to be doing stuff with.
Adam, I think it's a great question, and we should make Caitlin say them all and spell them all, because with vestibular issues, like some of the names of what you're given is ridiculous. It's crazy.
Yeah, and that's why a lot of times I like Mark's word of dysfunction, but I a lot of times think of like vestibular symptoms. And I think that's one of the scary things about vestibular is when we're in PT school, we get a million questions to ask about pain. You know, is it burning? Is it achy? Is it sharp? But dizziness, which is the symptom we think a lot about with vestibular dysfunction, is it means something different to everybody. And so I think it can be a little intimidating to patients and to students and to newer grads and new clinicians, because they don't know, okay, you're dizzy, but where do I go from there? What's the next thing that I'm supposed to ask? How am I supposed to kind of get through the weeds to be able to figure out how to help the patient the best?
Yeah, I do think that I think that students don't get enough of that in school either. I mean, you might get a lab or 2 labs on vestibular management, and they come out of school knowing anything and everything about orthopedic injuries and neurologic conditions and all these other things. But vestibular is just not one of the things that the schools hone in on.
If we're talking about that, we're talking about what's a PT coming out of school kind of should know, what they know and what they don't know. Because sometimes what we don't know what we don't know. What are some of the things about vestibular that I might not know? And unless I am listening maybe right now or taking a course, I literally won't know it.
I think they know that it exists, which is a good place to start. But beyond that, like Mark kind of alluded to, I think they're kind of scared and they don't know how to treat it. But I think what I wish a lot of clinicians and just the general population knew is it's super treatable. It's one of the quickest things that we can treat, 1 or 2 visits, and a lot of times you're back to feeling normal. And it's nothing that complicated. So it's actually a really rewarding thing to be able to treat, because nothing else gives you that quick of a turnover, and patients love you no more than when you get them not to feel dizzy.
You know,
if it's quick to treat the patient, if the treatment program is fairly short, what about the training to understand how to treat? Sorry, Ashley.
Very good. You're good.
I think it's like anything else. I mean, it is a quick treat if you're able to hone in on what the condition is and what the actual problem is, and you have your targeted treatment. But from a learning perspective, it's like any other system. I mean, there's anatomy, there's physiology, there's all these other interactions with the other systems other than just the inner ear. It's going to communicate with the ocular system, with your vestibulospinal tracts, all these other systems within our body that keep us upright and prevent falls, essentially.
Adam, you said, I mean, the question was said right. What you don't know, you don't know. And what's a kind of a, I think, an amazing thing is the more you learn, the more you realize what you can do for these individuals and maybe what goes missed and taking it to that next level. I also think coming out of school, talking about it being scary, you know, to hear from someone that's been through the experience of, let's say, a BPPV, which is where crystals in your inner ear get dislodged or they're not in the right place. To really, we can all visualize, a sprained ankle, the pain, how it changes the way we move, shoulder problems. But when you have no sense of what is up, what's down, things are spinning, your entire ability to function during that point in time is gone. And they're really nothing comes to mind that even relates to that when you have no equilibrium. It is, just from a position of empathy and reward for treating these patients. I mean, they cannot function, some of them. So cool.
Okay, I have two quick questions. You guys have mentioned the system. Ashley mentions crystals in your head. Describe the system for me.
So a lot of times with patients, I describe it as our sixth sense. It really helps us with equilibrium. It makes us feel like we're not on a teacup ride all the time. So it collects information from like our head position, our neck position. It kind of relies on our eyes a little bit, as well as like our lower extremities to kind of get some of that sensation in from our legs, and our brain computes all of that and spits it back out and lets us feel even keel and not like the world's spinning on us.
All right, and do I wake up one morning with this? What causes it? You mentioned dizziness as a symptom. What happens? How do I get this?
Yeah, I think times that often does happen is people just wake up, they get up out of bed and they just feel like they're going to lose their balance. You can also develop it from a slip and fall. It could be a viral infection. It could be more of a chronic issue that maybe not be a peripheral issue, peripheral versus a central issue. Two different things that we kind of try to tease out in our examination, and then develop a treatment plan based off of what we find. But yeah, I mean, I think that people can wake up with it, and it, like Ashley said, it's very debilitating.
You know what's amazing, Adam, is like in your inner ear, and this is dumbing it down, but like you have fluid and hairs that all send little signals to the brain to tell you where you are in space. I mean, between thinking about those the balls for Christmas, or the games that you move around for the little metal ball to move around, within your ear, you've got all that's just sending so many. Your body, even with the hairs, you've got like a gel, and as you move, like G-force, forward, back, side to side, the weight that pushes onto those hairs also transmits information so that when you're accelerating or decelerating, or it's phenomenal what the human body does, how it interprets, and what we take for granted.
Yeah, and not only just the movement aspect of it, but again, it correlates and communicates with our ocular system, our vision. So it allows us to track things. So track a ball if I'm playing ball, if I'm driving, and I could drive and things pass me and not get dizzy. So it basically allows us to function in the real world.
And who gets it?
Kind of like Mark said, anybody. You can just wake up one day with it. I've seen it in kids as young as high schoolers, and then older adults. It can happen after a hard-hitting sport, a motor vehicle accident, a viral infection. It really it doesn't discriminate. It knows no bounds.
You are at risk, Adam.
I am always at risk. All right. Well, okay. So if I were just to ask again, what are some of the main things that that I should know? We've talked a lot about them, but if it, like we kind of summarize from the patient perspective or just the general public perspective, what are some things that I should know? Because I think when we talk about vestibular, we also talk about concussion. So what do I need to know about the differences? And then same thing from the clinical side.
Yeah, I think first of all, big one that I harp is that it's not normal to feel dizzy all the time or to feel like you're off balance just because you're 60 years old or 70 years old or whatever it may be. Um, there's an issue there, and our systems naturally will start to decline. Our ocular system, our proprioceptive awareness, where our feet are in space, and our vestibular system. So just like as if you're training any other muscle in your body, we need to work on it. We need to revamp those things up. It's I think it's somewhere 50% of people 60 and older will develop a vestibular issue and balance problems. It's the third leading cause of hospital visits for patients 60 to 70 and older. It's something that's easily treatable and that you can work on for sure.
My kids started riding these electric scooters, and for some reason, I just keep thinking of all of this and them on one of these little scooters. And because when you turn, you're not like turning the steering wheel; you're shifting your weight, your balance, your focus, and all these things. And anyways, I don't know why my head keeps going.
Someone that like a patient, and there's a couple I can think of, but one particular person that came to mind. They were like middle age. She had like a hypofunction, so there was issues with just like communication, not just physical things loose or dislodged. And she was ready to give up her keys. She could not. So she get on the highway, and with cars and trees moving, she had to pull over. She would go dizzy, and no joke, within a month of doing the right exercises and therapy, she was back to driving, and she was ready to give it up.
Yeah. And Adam, to hit your point with the concussion thing, I think that they're not interdependent, but at the same time, our vestibular system can be a strong component of concussion management. And if you have a concussion, just like vestibular issues, they all present differently. So we got to figure out what the primary issue, and to be honest, oftentimes it's more than one thing. Usually it's some sort of vestibular ocular issue, some sort of cervicogenic issue, and some sort of physiologic issue. So I would say vestibular is really a component and can be a component of concussion, but it doesn't have to be a component of concussion. And I think oftentimes, especially as clinicians, we interchange those things. So we get a patient that is post-concussion syndrome, and all we think we need to do is vestibular therapy. And if that's all we're doing, we're missing the boat on it. So I think it's a piece, not the whole thing.
Oh, and okay, so that makes me think of another question. And Ashley mentioned it, exercises. And I know PT there's a very manual component to PT hands-on, and then there's also that exercise component of it. Is there a manual component to this? What are some of the exercises that you do? Describe some of that for us.
Yeah, there's definitely a manual component, depending on what vestibular condition it is. But like Ashley was talking about, those crystals, and if they're not in the correct place, we can do some manual repositioning techniques to get those crystals back where they need to be, allow those systems to work how they do. And then from there, we can also teach patients how they can do some of that repositioning, as well as kind of like habituation, kind of testing the system out a little bit at home with some of similar techniques. And then from there, it's like Mark was saying, so many other systems are related, ocular and all of that. So it's kind of reintroducing the body to all of those different things and teaching the body, you don't have to freak out. We're back to baseline. All of these things can work together and help the patient feel more even keeled.
Interesting. Does it hurt? Does like a vestibular dysfunction hurt? Like my shoulder would hurt?
It's a good question. I don't think it hurts, but I think that it can be very debilitating from that aspect of feeling off balance, feeling nauseous, feeling like the world around you is moving. So I don't think, unless you have a fall, of course, then it'll hurt. But I think physical structural pain, I would say probably not so much. And Caitlin, I don't know if you have other opinions on that.
I don't think it hurts. I think it's extremely uncomfortable. Just like the sense of dizziness and, like Ashley said, very fearful can lead to just general discomfort and uneasiness in patients, but not as much that physical pain like your shoulder might experience.
Well, I learned a lot. Does anybody have any closing notes to throw out there?
I think it's just a big untapped potential for patient population, one to get treatment, but also for clinicians to be treating. I don't think that there's a lot of clinicians that are just diving into wanting to learn vestibular rehab. And I don't really understand why, because there's not a lot out there and there is a lot of patients that need the help. So you can use it from a clinician standpoint. You can easily use it as a marketing tool to go into meet new physicians and kind of grow your brand that way and be the vestibular guru in your area. And then from a patient perspective, I think that knowing that, again, feeling unsteady, feeling uneasy, feeling off balance is not normal. And there's options available for treatment.
All right, Ashley, Caitlin, any final words?
No, I totally agree with Mark. I think knowing that PT is something that can help with it, and other rehab services can also kind of play a role depending on how exactly you're presenting. So if there's a patient out there who's experiencing it, don't hesitate to get help, because it's not something you should have to deal with.
Yeah, no, these are great points. I will say, and I would think you would both agree here, but it is a special thing to treat. So you really get to connect with someone. First of all, if you don't know what you're talking about, it can be hilarious on day one when you're talking about crystals in the inner ear. You just sound crazy. So you've got to immediately you got to know what you're talking about. And these individuals, they don't care if you got the magic potion, which it feels like that day one. It's a pretty special thing to connect and help these individuals that can't function. So highly recommend it.
I do have, now that made me think of another question. Sorry, and this is it, and I'm going to wrap it up. So if you think of like an elite level runner, a marathon runner, right? They have kind of a shape. If you think of a linebacker, they kind of have a shape, right? Different people who excel at certain specific things have like a shape, if you will. Is there like a vestibular shape that like I would excel at a vestibular function and it would allow me to do certain things? We're talking about tracking a baseball in the outfield earlier, right? Or something along those lines. And I'm sure a cyclist has to have a very strong vestibular system, I would think. But is that a thing? Is there research that dives into that at all?
I've never seen any, but now I'm interested too.
Yeah, yeah, not to my knowledge. I don't believe so.
Yeah. Yeah. I mean, obviously, like reaction times, coordination with high level. I love following F1, so I think what you're saying makes me really think like what they go through, forces on the body, reaction time. It goes back to speaking to the fact that these are things, whether you are bottom of the barrel in your abilities or the very top, you can train to improve them, just like anything else in the body. So.
Well, and that makes me think of back in school, we did VO2 max testing. And way back in the day when I was in the clinic, we would do blood lactate threshold testing on athletes. And vestibular performance testing would be, I guess, very interesting, wouldn't it? Yeah. All right. Well, let's wrap this up. And I do want to ask more questions, but we're going to start another session. I want to stop this recording. I want to thank everybody for listening. I want to thank you guys for being a part of the discussion. This was really helpful. And stay tuned for the next conversation about vestibular.